your medications just might be sabotaging your bone density.
I say this all the time. Every treatment has some kind of side effect or downside to it.
Right, so we're going to talk about the top 5 medications that are killing your bones, and you might not even know it. So welcome to Talking with Docs. I'm Dr. Brad Winnie.
I'm Dr. Paul Zalza. Under no circumstance are we saying stop these medications. You are on them for a reason. Your healthcare professionals started you on these medications. Keep using them, but just be aware that these might be having an effect on your bones, and we're going to just teach you ways to mitigate those effects.
Right, so maybe have a conversation with your doctor, make sure that you're on the lowest effective dose for the shortest period of time. But we're also going to give you some strategies that, hey, if you absolutely have to take them to treat a medical condition, you can do these things to try to deal with it.
And also check, do I really need to be on this medication? Because sometimes you get started on a medication and it just keeps going. And
10 years later, you're like, why do I even take this?
I was going to say 10 years too.
No way.
Yeah. 10 years goes, what am I thinking now? 10 years goes by, and then you're looking at your list of medications, like, I don't even know why I'm on that.
And especially older patients, like we see, like a lot of our patients are older that are getting hip and knee replacements, and they're on like 20 meds, you're like, why are you taking this? And they're like, I don't even know.
Yeah. I would say,
remember we did a video about polypharmacy and how you should probably reassess every now and then with your doctor, say, you know what, do we even need any of these?
That's right.
Okay.
Polypharmacy video, that's quite a few years ago. We should redo that one.
We should. Okay, so number 5 is excess thyroid hormone or thyroxine.
That's right. Not the right amount, excess. I mean,
right.
The right amount, you're probably in balance, but if you could be taking too much.
Right, so hypothyroidism is a very common condition, has very real symptoms, like you're cold, you have low energy,
slows your metabolism.
Yeah, slows your metabolism, you might have weight gain. So you're taking exogenous thyroid hormone or thyroxine, which is T4. This is the normal thyroid hormone that's circulating around in our bloodstream, and then that gets converted over to something called T3. But if you have too much of the T4, it can actually increase your bone turnover. So it not only helps make bone, but also breaks your bone down, and it tips the scales to more of the breakdown problem.
Right, so you want to check that, and that is one of the tougher ones to get the right amount. Once you're on that right dose, you got to keep taking it at the same time every day.
Right.
But it can really, if you take too much, it'll decrease the amount of thyroid stimulating hormone that you make, and then that can end up tipping the bone loss favor.
And I think a lot of people will be like, well, listen, I just want to make sure I have enough, because I don't want to feel hypothyroid anymore, right? So like, what if I take a little extra, you know,
Luckily, it's easy
be a hint jittery.
Yeah, get to work quicker.
Yeah, okay, that's number 5.
That's an easy one to check.
Yeah, so talk to your doctor, make sure that you're on a stable dose. And I assume, to be honest, I'm not an endocrinologist or a family doctor, but probably regularly you would measure this, maybe once a year or something, because stuff can happen.
Yeah, exactly. Okay. Second one, now these are in order of increasing detriment to your bone.
Yes.
So the second one that would be a little bit worse than that would be anti-seizure medications.
Right.
Obviously, if you're on these, you have to stay on these, and these you're usually on for a long time.
Right, so phenytoin is probably one of the older, more common ones that can really negatively affect your bone density, and the main mechanism is the old cytochrome P450 system.
Yeah, that's right. And basically at the end of the day, it's really just increasing the breakdown of your vitamin D.
Right, so your liver has this enzyme cytochrome P450 that does a whole bunch of jobs, but when you take phenytoin, it actually goes inside the cell, binds to this receptor, and then more of this P450 is made. So it just kind of does a whole bunch of things more often, but the impact on the bone is breaking down that vitamin D. So the answer is really just making sure that your vitamin D levels are stable. So find out what they are and then appropriately replace.
Yeah. And we've talked about taking vitamin D before as well. And at the end, we're going to tell you just a few things just to do around any of these medications, or we'll summarize so you don't take notes.
Okay, number 3 is aromatase inhibitors. So these are commonly used in breast cancer treatment, chemotherapy, and the purpose of this medication is to reduce the amount of estrogen. So a lot of breast cancer is estrogen sensitive, so these medications reduce the amount of estrogen in your body. So similar to menopause, this has a very significant negative effect on your bone density.
Aromatase. You might have thought it was medication to control body odor. It's not.
I knew you were going.
Did you?
Such low-hanging fruit. I knew you were going.
I have to take those. I have to take them when I can get them.
Yeah.
Yeah. So it's really just a medically induced sort of menopause that we're doing. And the reason you're on these, if you're on these, because of something like breast cancer, is those tumor cells love estrogen and grow when they see estrogen, so you block that.
Right, so people are like, well, why don't I just do HRT then? Well, no, that defeats the whole purpose of the aromatase inhibitors. We have to blunt the estrogen, and it's necessary, but it has very real negative consequences to your bones.
Don't stop them if you're on them, but we're going to talk later about the things you can do to mitigate these effects.
Right. Number 2 is a really interesting one. So it's proton pump inhibitors.
PPIs.
So do you know, I looked into the prevalence of this and incidence. So like they've estimated that 1 in 4 people will be on a PPI at some point in their life.
Oh.
And currently in the US, like 8.5% of people are taking a PPI. So like 1 in 12 people is like always taking something to control the amount of acid because of heartburn or dyspepsia or whatever, because they've had an ulcer. Isn't that a crazy number?
That's insane. Do you take?
No. Do you have heartburn?
No.
Oh.
I don't. Do you?
No.
But
otherwise, I'd be taking one.
Not
Well, I guess
necessarily.
maybe. Yeah, I guess. Yeah.
I was thinking that scene in Dumb and Dumber, wasn't it? That guy.
Yes.
That he makes me all the hot sauce and
Yeah, and
to
he
his
puts it in,
detriment. Yeah.
and then
Okay.
Are you okay, man? It was just a goof.
Ow, my ulcer. My pills.
So what this does, it reduces the amount of acid in your stomach. And obviously, your acid is in your stomach for a reason.
Yes.
Like it not only protects you from pathogens, kills some pathogens that are in your GI tract, but it also helps to break down food. And one of the things that it compromises is your body's ability to absorb calcium from your food or even from a supplement.
Yeah. Fair.
Right, and so a lot of people are like, well, what if I don't take a PPI? What if I take like an H2 blocker, which is a very different class? So what I would say there is that is less effective at reducing the acid, so the effect is less, but it still has the same general effect, just less severe.
And again, talk to your healthcare professional if you're on this, because we don't want you to get an ulcer by stopping this or anything like that, but just recognize it.
One specific thing that might not come out in the general takeaways as far as how to combat all these things is for the PPI people, PPI people.
Yeah, PPIP.
The PPIP, is to take calcium citrate instead of calcium gluconate. Calcium citrate is less dependent on the acid for absorption.
There you go. All right, and the last one, probably the worst one, and we see a lot of people on these, is just steroids. People are on steroids, and we like medical steroids. We're not talking about in the gym steroids. Glucocorticoids, right? These are things like, what this does.
Did you think that I was on anabolic steroids?
Yeah. I was gonna let you know it wasn't working. Up your dose.
Wow, that's so rude. That's so mean.
You're wasting your money.
So,
you know what really is I was
mean.
distraught at the fact that I go to the gym I go to, in the change room, there's a Sharps container.
Oh, yeah,
and it's full all the time. And I'm
you're
like, all these people aren't on insulin, diabetes. These aren't that many people with diabetes at the gym.
No.
It's like alarming. But
having said that, maybe a bunch of them are taking GLP-1s though nowadays,
Yeah,
because a lot of people are taking that. But I think it's probably more
not the
anabolic
gym I
steroids.
go to.
No.
I'll tell you.
Okay.
So, all right. So
Glucocorticoids.
Yeah. So this is like prednisone, for
Yep,
example.
it's the
You're
most
on
common one.
and you can be on prednisone for a number of things: rheumatoid arthritis, or psoriatic arthritis, or any sort of inflammatory condition.
Polymyalgia rheumatica, we see that.
Yes, mostly things with poly in them are good, but this is not.
Yeah.
And so we see a lot of people on these steroids, and you know you don't stop them all of a sudden, you taper them off and all the rest of it. So if you're on this, stay on it, you're on it for a reason. However, be aware that they decrease osteoblast function. Those are the cells that make bone. They increase osteoclast function. Those are the cells that break down bone. And they also mess with your calcium absorption. So it's like a trifecta.
Well, I think what people don't realize, or maybe don't realize, is that bone is kind of actively always turning over. So there's always bone making and bone taken away. But it's that balance. We need to either stay equal, and rarely are we ever increasing the amount of bone, except maybe in the setting of a healing fracture kind of thing. But yeah, we want to mitigate this. The trouble is, often people are on these for a long period of time. So if you have to have a short dose because you have a severe asthma attack, and maybe you're on it for a week or two, that actually does not affect your bone density. It usually starts causing a problem after 1 or 2 months. So definitely you need to think about lowest effective dose, shortest time, and lots of people will try to taper off, but then their symptoms come back. So then the rheumatologist is usually managing this, or the endocrinologist, and they put it back up, and they try to bring it back down again. But this could take years, and some people are on them for life, like low dose for life. And this has a very, very severe. We've seen it in particularly hip fracture patients. Severe thin skin, brittle bones. It really has a drastic negative effect on your bone metabolism.
However, they're wonderful at controlling
Life-saving.
inflammation.
Yes, for sure.
And like it says in the Bible, bone giveth and bone taketh away.
I don't think it says that in the Bible.
Maybe you're right. Have you ever been on steroids, corticosteroids?
No.
No, a dose of prednisone or anything like that?
Never,
No?
zero. This always reminds me of that time that, remember you had that.
I did. Yeah, I've been on it. That's what I was getting at.
Okay,
A short stint in the ICU. Another video.
Share the short story.
Another video.
So Paul almost was refusing, like, because he had T-shirts like, you need this. And he's like, I don't want to get avascular necrosis of my hip. I'm like,
which is another cost.
I'm like, bro, you need to take it.
We'll make another video about my tour of the ICU.
That's right.
10 years ago.
Okay, so now you know the top 5.
Okay, so what can you do about it? You
Right,
don't
because
wanna
somebody's like, thanks a lot. No,
Yeah.
no, now I'm afraid.
Yeah, and I'm depressed.
Yeah.
No.
What can I do?
There's stuff you can do.
Okay.
Weight-bearing exercises.
Yes.
These are, if we've said they're important before, they're really important now. If you're on any of these medications, you want to help build your bone, give your bone a fighting chance by doing some weight-bearing exercises.
In addition to weight-bearing exercise, I would add resistance training. We have never been more aware that as we get older, the less you want to lift weights, the more you probably should be lifting weights. Not so that you look good, that is a bonus, but that your muscles are pulling on your bones to stimulate that bone formation.
Remember that time in residency when I was struggling reducing a femur fracture? And this was like many years ago, and my staff surgeon said to me, he goes, Paul, do you work out? I'm like, yeah. He said, with weights? I said, no. And then he said, you should. Now, I don't know.
Talk about humbling.
I don't
Training
know.
is so humbling.
He may have been way ahead of his time,
Yeah.
I like to think, or he was just frustrated by my still developing surgical skills.
I feel like he just was
The latter?
shaming you. Yeah, that kind of shame-based learning that we were all part of back in the day.
Anyway, okay,
So
so
that's number one, exercise.
and then just make sure your vitamin D is good. Keep
Right.
taking calcium and vitamin D.
Most people take not enough vitamin D, I'd say.
Fair.
Yeah, so the RDA is like the 400 to 800, but probably we should be taking 1 or 2 or even 3,000. Some people would even say more than that. So talk to your practitioner and definitely make sure you're taking adequate vitamin D.
And watch our video on vitamin D.
Right, along with calcium and vitamin D, definitely adequate protein. So not extra protein, not 3 times the normal amount of protein, but definitely adequate protein. As we get older, often our protein intakes increase a little bit. Sorry, our needs increase a bit and our intakes decrease a bit. So those definitely need to be matched. So adequate protein for sure.
You don't want to be called a tea and toaster.
No, definitely not.
Somebody who drinks tea and eats toast and nothing else.
Yeah, not a lot of protein.
The other thing is consider getting your DEXA scan.
Yep.
Consider getting some sort of bone mineral density measurement as a baseline so you can see if these medications are really doing what we're suggesting they may do.
Yep.
So you can keep an eye on it. That'd be my next suggestion.
Yeah, and then the last one would be if you have a DEXA that shows that you have osteopenia or significant osteoporosis and you require to be on these medications for a long period of time, they may talk about medications. So either bisphosphonates, something like Fosamax, or denosumab, which is known as Prolia. These are actually bone making or things that reduce the amount of bone turnover to protect your bone density from the medication.
That's right. Talk to your healthcare professional about those, but recognize those medications have their own side effects too.
Yeah, little honorable mention for over-the-counter stuff. Aluminum-based antacids like Malox certainly have a negative effect on your calcium balance and your bone density. And these are something that someone just kind of swigs away. They don't even, their heartburn's never bad enough that they go talk to their doctor. So their doctor doesn't know they're taking it, but they're taking it on a regular basis. Definitely has a negative effect. And then other people, another chronic condition, constipation. If you're taking a stimulant laxative, something like Dulcolax or Senecot, these have a negative effect on your bone density as well. So.
That's a mouthful for you guys, all right? Those are all the medications that can affect your bone. We see this is how we see our fractures that come in and things like that. We see people on these medications and the consequences of them. Don't stop these if you can, but don't stop them without the guidance of the person who started you on them or the guidance of a specialist in that field. Be aware of these effects on your bone and try and mitigate those effects with some of the things we talked about.
Now you know. If you like this video, please like it, subscribe to our channel, check out our other long-form content over on YouTube.
And remember, you are in charge of your own health.
See you next time.